we've been able to host an in-person TOD forum. Thank you for coming. It's great to have everyone here. Part of our charge in the TOD office is to provide and connect our partners with resources on TOD-related topics, which is the purpose of this forum. To that end, I'd like to leave an open invitation for ideas for future forums. So if you have ideas or questions that could be addressed through a forum, we'd love to hear them. Please let me know. The topic of today's presentation is TOD and public health. It's not a new topic, but it is a very dynamic topic. Our understanding of the role the built environment plays in health continues to grow and deepen. Just last month, the New York Times published an article on the role the built environment plays in type 2 diabetes, and this is just a slice of the broader TOD conversation. So the article states, researchers who study type 2 diabetes have reached a stark conclusion. There's no device, no drug powerful enough to counter the effects of poverty, pollution, stress, a broken food system, cities that are hard to navigate on foot, and inequitable access to healthcare, particularly in minority communities. And actually just earlier this week, you may have seen it, the Star Tribune ran an article featuring Yingling fans' work studying the link between transportation and emotional health, which we'll hear some about later. So how does TOD fit into this conversation? There are a lot of definitions of TOD, but this is a definition you may be familiar with. So transit-oriented development is moderate to high-density development served by frequent transit and walkable streets in a neighborhood with a mix of uses that allows people to live and work without a car. So transportation is at the very heart of effective TOD. That of course includes high-frequency transit. I think it's worth noting that with the projects that we're working on right now on the right, we're going to expand access to high-frequency transit in the region by 1/3 in the coming years. When you include all of the planned lines on this map, that will essentially double access to high-frequency transit across the region, which is substantial. But it also fundamentally includes streets that are safe and convenient and pleasant to navigate for pedestrians and cyclists. So that's also a really fundamental part of making transit-oriented development work. It can really get in the way, or it can be a huge benefit to TOD. But I think it's also worth noting that TOD is never just about one outcome. The same strategies that we're going to be talking about here that can improve health outcomes also have significant benefits for safety, for equity, for reducing carbon emissions, etc. It's a very broad benefit. And I think it's worth thinking about that when we listen to the presentations about how they relate to all of these other outcomes. I came across this quote by Isabella Cawthorne, who's an urbanist in New Zealand, and I think she was commenting on a climate action plan, but I think it captures it well. The quote is, delightfully, a neighborhood structure and layout that's head and shoulders better on all important things for local business, for healthier and happier kids and old people, for long-term relationships, for biodiversity, for resilience, so on and so on, also happens to be exactly the structure that's low emissions. I think that really sums it up well. With that, I'm going to introduce our first speaker. And just so you know, we're going to have a question and answer at the end of all of the presentations. So Nissa Tupper is the Transportation and Public Health Planning Director in the Office of Sustainability and Public Health at MNDOT. She works and partners to embed public health and equity practices into transportation decision-making. Her approach is informed by a diverse professional background in communications, landscape architecture, and public health. Welcome.
All right, thank you. It's so fun to be at an in-person event, more and more of these. So the Office of Sustainability and Public Health is relatively new for MNDOT. I think it's a really exciting opportunity to push the narrative and the work that we're doing in defining what is transportation's purpose. So you can see on the slide here a number of things that we focus on related to sustainability, climate resilience. The one in bold there is the part that I work on the most, but as you can tell even from the introduction, that all these things are interwoven. So when I think about transportation and public health, I wanted to share this slide. Dr. Ed Ellinger, former commissioner at the Minnesota Department of Health, used to share this about those silos of transportation, public health, medical care, and how the intersecting fields have become siloed over time, and we're slowly trying to bring those back together, but we have some work to do, and I think this perspective still resonates today, where, you know, when we talk about health, medical care says, yes, that's our job, look no further. Public health says, well, we want to be at the table, like we want to look upstream, we need to be part of these conversations and decision making. And then you knock on the door of transportation and they're like, well, we just build roads, it's not our job. And you know, I think there's plenty of us that are starting to change that narrative. We know that medical care really only accounts for about 10% of your health outcomes. Public health's focus is really shifting to that upstream. What are those system factors that are allowing us, giving us access to have healthy outcomes? And transportation, you know, shifting from a model that moves cars to one that moves people. So I started at the Department of Transportation about 3 years ago. I was doing a little background about, you know, the transportation and connections to public health, and I found it striking that when our agency was created, we were named the Department of Highways. So that sole purpose was to move vehicles, to build highways. That changed in the mid-70s to the Department of Transportation, which means multimodal, which means centering people. And so that is something that I want to continue to bring up wherever I am, and that's something that we can't forget. So our vision also, I think, is really striking. Health is right there, front and center, the health of the people, environments, economy. You know, that's a heavy lift when we consider the context of the transportation system that we have and the people whom we're serving. So in terms of the transportation system, in Minnesota, we have one of the top 5 largest transportation systems in terms of public miles owned by MNDOT and partners. MNDOT owns or operates only about 10% of all the roads in Minnesota. Often people think transportation, they automatically think MNDOT, but we have a slightly smaller stake in the game, I think, than some realize. But that requires a lot of partnership, and that's on us when we think about what is the system that we're trying to build. We also know that transportation is the #1 source of carbon pollution. That's here in Minnesota, that's across the nation. So there's an onus on us to be thinking about how are we building the system for a healthier future. We also know that car ownership is not accessible to everybody. It's expensive. It's about $11,000 per year. That just crossed the $11,000 mark, I think, this year. And so when we think about that system, who are we building it for and what's that infrastructure look like? You know, it has to be multimodal. So these are all of the, this is the full transportation context of where MNDOT gets involved. So yes, it's about highways, but it's about walkways, pathways, freight, transit, shipping as well. And then when we think about the community context, the people that we're serving, I think there's some trends that we need to really be thinking about in terms of how we're connecting health. We know that we're a state that's growing. We're anticipated to get over 1 million new residents by 2070. We also know that we're a state that is aging. Our 65+ population is anticipated to double by 2030. About 30% of, we'll see about 30% growth in our communities of color. We're becoming more diverse. And when we talk about public health as an umbrella, you know, we're a healthy state. But if you start to unpack that, we have some of the worst health disparities, especially when we look at health conditions like cancer, diabetes, and heart disease. And you know, for me, from transportation and public health perspective, it's really about, you know, what is happening that's undermining everyone's ability to live a healthy life, and that's part of what we need to center. So some of the transportation, health, and equity connections, you know, in the transportation world, I think there's, you know, we immediately think about safety. And we need to be thinking about safety for all. So oftentimes we talk about, you know, the fatalities and trend line for serious injuries has gone down for motorists. That's great. At the same time, if we look at that trend line for non-motorists, in that same time period, it's gone up. So we're doing some things that are working for people who are in vehicles, but we're doing things that aren't working for people who are walking and biking. Obesity and heart disease, you know, the slide earlier, you know, there is a lot there with behavior. But we can't expect people to get physical activity if we're not providing them access to that infrastructure. So how are we providing walkable communities, safe communities where you can go on foot and go out and about in your daily routines? The other pieces related to breathing impacts, respiratory conditions, linked to things, those tailpipe emissions. So air pollution, who's benefiting and who's being burdened by our transportation system. We think about redlining and where our transportation, our highways have been built, and those communities that are adjacent to those, and the impacts from that air quality. Heat-related illness, there's certainly a role to play here. I think the number is about 30% or 30 degrees cooler under the shade of a tree on a hot day. That's significant, and trees provide much more than that. So when we think about heat islands and our infrastructure, how are we building beyond the pavement to create places that are cooling the surface temperatures and providing places of respite for folks that are using the infrastructure. So something you'll hear quite a bit about today, social determinants of health. Denise will talk more about that, but I mentioned about 10% of our ability to achieve our best health is determined by medical care. If you look inside moving out, those are individual or downstream impacts leading out to upstream or system impacts. So the further out you get here, the more impact it has on your ability to be healthy. So that blue shading on the outside, those socioeconomical, cultural, environmental conditions, those are really what's setting up the system for us to be able to access good paying jobs, be in safe neighborhoods, connect with our community, access healthcare. And that's where we really need to focus when we think about how are we making that connection to health and transportation. And bottom line, healthy communities make healthy people. Transportation's relation to this isn't just about physical, there's also the link to mental, social, emotional, and cultural. So that's a narrative that's shifting at the DOT, which is exciting. There's a recent project, Community Conversations, if you Google it. These are the districts, how MNDOT is broken up in terms of serving Minnesota. We have conducted community conversations with representatives in each of these communities to understand what does transportation mean to you, what are the barriers you have, why is it important, what can we do better. And there's so much great information in there. We've been really good at pulling quantitative information, statistics, level of service, all those things. But we need to get back to talking to the people who are in their communities and understanding from their perspective, what makes it hard for you? What makes it easy for you? What's your vision for the future? So there's a lot in here, and it seems pretty basic. Like, we need affordable options, we need convenient options. If you live in a community that is designed for cars, that means you have to have a car to get around. And so just bringing it back to people, I think will instruct us really well moving forward. So one of the things we've done over the past couple years, I'm excited about, as I got to work with Dr. Yingling, who you'll hear from, to provide us with a new framework for how do we talk about transportation public health, what's our guidepost moving forward. We wanted to understand what others were doing, so looking at peer organizations, what are those pathways to influence for transportation and public health. So she conducted a literature review, did some interviews with some of the peer organizations. There's a great report that's posted on our website. There were 8 frameworks and 3 tools that were part of the literature review. And there were 9 themes that came out of that. So active transportation, environmental pollution, traffic safety, access to destinations, equity, public transportation, mental health and well-being, climate change, and resilience to disasters. Those were mentioned the most when the research was done of how are transportation and public health connected. And there were only a couple that were consistent across all of those frameworks, and those were active transportation, environmental pollution, and traffic safety. And out of that, this is the new model to support our approach to transportation and public health. So on the outside ring, you'll notice these were mentioned in that social determinants of health graphic. So those are carried here, and that's where we need to start when we're thinking about those connections. But the research, pointed to the fact that we need to think beyond social determinants of health. And what are those pathways to how we're providing access and power to get to those things. So, behavioral health pathway, what are those opportunities for physical activity, social interaction, being able to access nutritious food. Environmental health pathway, that's probably a little bit more familiar for a lot of folks. How are we structuring an environment that's providing safety from things like crashes and noises and crime. And then social inclusion is a newer one that I'm really excited about. That pathway is about, how are we setting up our decision-making process and our other processes to provide access for people to have power over that decision-making, have a voice in what happens in their community and places. And so that's really about that engagement and process of decision-making. And if we think about all of these together, that's what's going to support the equitable health outcomes. And I really think that we have to focus on equity to advance public health. You can't advance public health without that focus on equity. So one of my last slides here, teed up to think about TOD and streets. One thing that we have a reinvigorated focus on is complete streets at MNDOT. We've had a policy in place since 2013. We just finished an update to the policy. We have some new resources, including new performance measures and reporting for accountability. Complete streets are really about addressing the needs for all users. And when we think about that, really honing in on relative safety. So, you think about all of the things that provide safe transportation when you're in a car. We don't even think about, the mass of that vehicle, the airbags, the lights, all those things. And you think about the safety for somebody walking or biking. You might have a helmet, you might have a stripe of paint. If you're lucky, you have a curb, but it's far less. So we really have to be thinking about relative safety of people walking and biking first. And this is an approach, complete streets, that is expected for all projects in MNDOT. There are some exceptions if you're not changing the structure or layout of the road or impacting how users are interfacing with it. But this applies to really any context. So sometimes people think, complete streets, it's only those places where you have the separated bike lane, the sidewalk, narrowed lanes. But this is something that is asked for and that we do quite a bit in small towns. A lot of our highways run through small towns and are their main streets. So there's that balance of we need to move that regional traffic, but that's also a place where people are shopping and want to stop and need to cross. And so this is an example, Lake City, Minnesota, recently, and there's a lot of great design things that can be used where you can shorten that crossing distance for people walking, provide more visibility. Roundabouts, you're slowing down that acceleration time for people, there's more visibility there. So there's lots of great work happening with complete streets. I think that has a great connection with TOD. And if folks want to learn more, this is the public health website. There's a link to the new Complete Streets website as well, but go ahead and Google it. And just thank you for being here today. I'm going to hand it over to Denise.
Thank you, Nissa. I actually did get a chance to read the Health and Transportation Nexus, and it's a great document if you have some time to review it. It mentions TOD several times throughout the document. So our next speaker is Denise Engen. She is passionate about making places better for people and the planet. She is the Principal Planning Analyst. She is the Principal Planning Analyst for Hennepin County, Minnesota, helping to develop healthier communities, places, and infrastructure, and to increase equitable access to health-supporting activities, facilities, and infrastructure. Her 25-plus year career includes active living, comprehensive and land use planning, site design, community engagement, community development, and transitway planning. She holds a Bachelor of Science in Landscape Architecture from the University of Minnesota, as well as a Master of Public Affairs from the Humphrey School of Public Affairs. When she is not working, Denise enjoys creating her own indoor and outdoor spaces that welcome and cooking for a crowd.
Good morning. As you just heard, I'm Denise Engen. I work on active living projects for Hennepin County in the Housing and Economic Development Department. And I really want to thank Metro Transit for hosting this forum today on an important topic, health and TOD. Whereas I'd like to personally think about it, creating healthy and complete communities that also support transit use. Michael's quote actually got to some of that. An overview of what I want to touch on today, similar to what we heard from Nissa, is that we're not getting uniformly positive results and outcomes on health, well-being, and economic inclusion for people. And a lot of that is our built environment, and that we can really, in order to have different outcomes, we need to take a different approach. And I think moving beyond an infrastructure maximizing approach where we really work to make our roads happy, our soils happy, we need to really look at the context that this infrastructure is running through our communities, which are a system in progress. It's like my husband's a pilot, he travels, and when he comes home, I'm like, this is a family in action, and you gotta step on the merry-go-round and blend in. So we are not stopping, and we've got communities that operate and they function, and people have lives and commerce, and we need to take a different approach to have better outcomes. So, want to live longer? Influence your genes. This is an article of last month in National Geographic, and I thought it was both really compelling and also a little problematic, because it says, making healthy lifestyle choices, you can self-engineer genetic alterations to prevent disease and boost longevity, and that each healthy act switches on youth-promoting genes and switches off genes that make you age. Now, you can look at it in a couple ways. If this is all on you, then shame on you. But it isn't. It just really isn't. It's what if your environment, page down here. What if your environment limits healthy choices or makes those healthy choices really hard? What kind of genetic alterations are we making that? And are they really in our control? Such as if you can't walk to a local destination because they're not connected to your neighborhood, or if the route is unsafe, dangerous, or really stressful, or if we can't access healthy food because there's no local outlet, you don't have income, or you don't have transportation that's reliable to get there. So to put this in context, as in health, health is a really broad term that encompasses many aspects of our lives. It's a state of complete physical, mental, and social well-being, and it's not merely the absence of disease or infirmity. And the World Health Organization put that down in 1948 in its constitution. So that idea has been out there for a long time. And we know that health has really been on our collective minds, certainly since 2020 and the start of the pandemic. And to this day, we hear about how people are affected by disease and COVID differently, depending on if they, by their race, or if they have an underlying condition such as diabetes or heart disease. And like, where does that come from? And as Nissa mentioned, our health is a lot more than biology or healthcare. It's about 80% more. 10% of your health may be related to healthcare, 10% to biology, but the vast majority is the conditions in the places where people live, work, learn, play, that affect our health risks and health outcomes. It's what happens to you over your life. And these conditions are known as the social determinants of health. Many premature deaths are attributed to those conditions. So in Minnesota, we know Minnesota Department of Health has put this graphic out for us. It says, adults in Minnesota households earning less than $35,000 per year are 2.5 times as likely to have diabetes. And we know that that is access to healthy food and is a lot related to physical activity and moving around in your day. So again, as we've heard, healthy communities make healthy people. And I will just say that many of the problems and solutions to improving our health are affected by how we plan and design our communities. We have a really strong role there. Local governments turn key levers that can affect individual and community health in some pretty profound ways in what they and how they do or do not regulate, permit, design, support, or encourage. So generally in statute, the purposes of community planning are to promote the health, safety, and general welfare of the population, to manage growth, change, and renewal of a community, and to improve the quality of life for its residents, and to protect people from activities of their neighbors, like land uses. And we use tools such as zoning and comprehensive planning, environmental health and safety regulations, we've got occupancy rules, design guidelines, and then in transportation we have planning, design, and transportation enforcement. So there's a lot of things that affect these different environments that profoundly affect people's lives. And while our modern city planning had its origins in some really pretty profound health problems of the 19th century, those were what they, those were disease. But we have our practices that we have a legacy from 20th century planning practices of impacts where we reacted to those 19th century problems, and now we have our own new problems from single land uses, sprawl, redlining, and urban renewal that cut up communities and more. So we have more chronic disease problems that we have given ourselves. So some populations and places have been burdened more than others, really due to various forms of neglect and discrimination, and they result in disparities that are seen in multiple areas. Hennepin County has called racism a public health crisis. The organization has defined 7 disparities wheels that we are actively working in. You can see they really track with what we've seen in previous slides from Nissa and from the social determinants of health. These are all areas that the county works in, and so we know that reducing any individual disparity here leverages positive change and helps reduce disparities in any of the other ones. That these domains are very interconnected, but they're also very integral to reducing disparities. You've got to approach all of these. It seems daunting, but we know we can do a better job to yeah, it's fine, we're good, it's all fine. But we can do a better job to avoid social isolation, increase connectedness, increase our ability to be active in your everyday life so you don't have to think about it. Avoiding and mitigating environmental hazards and climate impacts, reducing disparities by increasing opportunity and creating complete communities. We can do that better. And health is an excellent framework. These 3 little bubbles show places that we're really talking about that in different places. So the Healthy Communities Policy Guides from the American Planning Association. There's really robust work on metrics and healthy comprehensive planning and all sorts of stuff there. You see MNDOT's framework, and then my own health plan when you go through and you try to get your points to get $20 less on your copay. There's a quiz, and the quiz is like, do you have trouble building or maintaining relationships? Do you have affordable and quality housing? So I'm being asked that in my health plan. So this framework is really excellent to help frame and assess our efforts to make communities more livable, more resilient, more sustainable, and more equitable. So I'm going to kind of go fast through some examples here. I work in this healthy community planning and active living, on active living projects. And so we partner to try to create healthier communities, healthier places, healthier infrastructure, healthier policies. And we work in a really unique framework. The other circle is the Minnesota Departments of Health SHIP program, it's Statewide Health Improvement Partnership. So our funding comes from the Minnesota Department of Health, and they fund us to work on healthier environments. And so within Hennepin County, we are a unique partnership between public health and housing and economic development. So we take these 2 areas, find the overlap of where we have concerns that we can work on together, like walking and biking, healthy business districts, safe crossings, communities that support zoning for healthy eating, and etc. And then we work with communities and community-based agencies and other partner agencies like MNDOT to work on projects and we bring that lens to those projects and try to find common ground. Just quick, I'm not going to read all these, but we help cities develop policies, plans, and implementation strategies. A recent one was City of Champlin, just completed a complete streets policy. Basically, we help partners, we fund that, or we provide technical assistance. And so October 24th, the City of Champlin adopted that policy. We help cities engage all in the design of their communities. That's been a really big focus the last maybe 6 years or so. COVID put a pretty big dent on what we could do, but it's been a focus and it will be a focus again. We do activation events, surveying, technical assessments, demonstration projects. We help cities pilot infrastructure improvements. Hey, Sean is here. We tested bike lane options in St. Louis Park on 28th Street. They're built now, right? Are you there? We did some stuff in Brooklyn Center on 57th. We did an activation event in the Starlight Shopping Center in Brooklyn Center Park. It was in Cub. People wanted to be able to walk from the street and from the Starlight transit center to the grocery store, and they kept saying, we need a walkway, we need it covered, people asked for all sorts of stuff. So we did a demonstration project, and Cub went, hey, wow, that's actually a good idea. And they put in their own curb cut so that people can get there. So we help people look at how they might use their environment a little differently. And we have a small amount of funds, but we just leverage them where we can. We make investments to support healthy living, so we fund benches, bike repair stations, bike locks, fruit trees, community gardens, and new in 22 we were able to get health equity kind of variance from Minnesota Department of Health to fund equipment for active living in a park or outside of a park setting, but in a park setting, but outside of it to address active living, so that there is more equitable access to certain activities. So we were able to fund equipment for that. And then we help partners learn best practices and share information by hosting forums like these that we, again, hope to do soon. Then I'm going to show you a few examples. Now let's see, do we have anybody here from Hopkins? Aha, Hopkins. We were one of the partners that worked on the Hopkins artery experiment. So again, we were one of the partners who helped provide technical and funding assistance for a really dynamic a demonstration project plus much more to find out how to connect a future and proposed transit station to the city's downtown in a way that was more than just getting there. It was that pedestrian seductive environment that the city was trying to create. So how could you do that? It was with art, and it was with green infrastructure, and so they received a lot of great feedback on how to do that, and really focused on getting input from a wide variety of communities and people in Hopkins. So it opened in 2018, and in 2019 it got a Minnesota Planning Association Partnerships and Planning Award with its partners, which were Hopkins, Hennepin County Metro Council, and Three Rivers. And it also got a Great Streets designation nationally. Another one was an infill opportunity that is going up right now in Ridgedale. The city of Minnetonka had an opportunity to create a public park under the section of Ridgedale Mall parking lot, and they were having trouble reaching some certain segments of their population, particularly youth and other BIPOC communities. And they contacted us, and we funded engagement of underrepresented groups to learn what people wanted to see in that space. And we employed creative art space engagement at a city festival that they came from an employee suggestion in the city, and we did targeted outreach within the mall. Great, a lot of input, and the city was very pleased. It really informed how they ended up taking the direction of that park, and it's getting built right now. Last one is one that was a stretch for us. It was the Hmong Community Explore Your Parks event. We were asked by our public health colleagues because they were exploring how to decrease the disparate outcomes that the Hmong community faces in diabetes. And they had a community leadership team that asked for a project that got people to use and be more comfortable in public spaces and parks. And for us, we included transit in that because that's part of our mission. And so we really focused on encouraging the community to use public parks and spaces. And that was difficult because, and be active for lifelong health, because there was a lot of things to learn and a lot of cultural reasons that we had to engage the community about. And what rose to the top was they really wanted an event where the community could gather itself together and do an event and explore some of these things. And that was difficult because COVID came along, and that was a population that was really hesitant to be out in public then. They were facing, again, disparate outcomes in COVID, but that was really important. So they stuck to really wanting to do this festival. And so we did in 2021 and then in 2022. And this year, where we're trying to get it to be more community-based, community planned, 400 plus attendees from the Hmong community in Brooklyn Park and Brooklyn Center, Hennepin County. That was a lot. And we had 18 event stations, lots of activities, and health supporting activities as well as physical activity. And then if you can see, there's a little picture in the middle. There's 3 people standing in front of a bus. Serendipity was so fun. The younger man on the right is a Metro Transit bus driver. We had a bus there. People could, within a low stress situation, practice how you get a bike, on the bus, get on the bus. It's a community that's a little transit skeptical. But the man in the middle just came to the event with his wife. Well, he was the first Hmong bus driver hired by Metro Transit way back when. And they met, and it was such a cute moment. It was just adorable. And then new and developing work, we're going to be working on walkable, bikeable business districts, community hubs, and transit connections. Big, long word. But that's one of the things that Minnesota Department of Health SHIP wants to focus on, walkable, bikeable, like certifications or something. And so we've got economic development projects, we've got a number of things that we're working on with partners. And so we want to identify, modify, or create a tool or a framework that our cities can implement. And we want to do 2 or 3 of those in the next few years, so watch for that. And then I will leave you with a challenge, which is really to bring a human-centered health context-informed approach to your own work. Because if you put it in your vision, if you put it in your mission, if those words are there, then you're going to start to organize, plan, build, evaluate with corresponding metrics and corresponding methods. And in so doing, I think we have a strong chance to move those disparities wheels in all our communities and create better environments that in turn will give us better health. So thank you.
Thank you, Denise. Our next speaker is Yingling Fan. She is a professor of urban and regional planning at the Humphrey School of Public Affairs at the University of Minnesota. Her research centers on human well-being and people's lived experience in urban environments for building healthy and just communities. As a community-engaged and interdisciplinary scholar, she has advanced the broader institutional efforts in higher education for promoting research that is the most relevant to the interests of communities and the challenges facing society. Her academic leadership includes serving as the founding director of the university-wide Global Transit Innovations Program and the PhD program director at the Humphrey School of Public Affairs.
Good morning. I wanted to thank Metro Transit TOD office for organizing this event. Thank you, Michael, and thank you, Lene, for putting in the effort. And I'm very delighted and honored to be able to present alongside a group of leading practitioners, Denise, Nissa, as well as Elissa. And I think they are at the forefront of making our cities and the regions more livable, more sustainable, and more equitable. So today my presentation is titled TOD and the Shared Happiness in Cities. So the emphasis is that the connection between transit-oriented development and shared happiness. How many of you watched the Summer Olympics game in Tokyo, like on TV? How many of you? I see a lot of nodding. So do you know that the Summer Olympics in Tokyo had a motto, united by emotion? Okay. And that motto really resonated with me because sport is something that can really generate shared emotions. And the shared emotions, especially in a space such as a sport arena, would definitely unite people and connect people across different backgrounds, people with different backgrounds. So I cannot help but wonder whether transportation could function like a sport. That could, because transportation is a space in the city that really where we pass by each other and intersect with each other, right? So can transportation function like a sport, generate shared emotions among people and thereby help us to unite and then connect people of different backgrounds? Can we have united cities by transportation? So that's a question that I'm very interested in asking, and as well as try to find answers. And I think it's very important for us to design transportation systems that could lead to more unity in our city or lead to more human connections. in order to do that, it's very important that we understand the individual and the population level differences when it comes to people's experience or people's emotions in the city. And it's very important that we design policies and interventions in the city that promote shared experiences. And I have to say that public transportation and transit-oriented development are especially suitable for creating shared experience in the city. Okay, I think if you think about private transportation, right? If it's a private, it's not shared, right? If it's a public, it's shared, right? So we have to think about how we can best design our public transportation infrastructure. And TOD is especially fitting because if you think about the type of walkable environment where people will have more human-to-human interactions in those neighborhoods, TOD-oriented, transit-oriented neighborhoods. So I also wanted to give you some background about the type of status quo that we have currently, right? I think it's fair to say that most U.S. cities are auto-dominant cities, right? If you look at the percentage of people who take public transportation or bike or walk, it's less than 10%, okay, in most of the cities in the United States. So this picture, the pictures, it's I took one of the pictures, actually I took two of the pictures. From a field trip I made in Arlington, Texas. So I don't know how many of you have been to Arlington, Texas. It is actually, I don't recall whether it's the 5th or 7th largest city in Texas. Okay, so I think you can look it up, but it's actually the population size is not small in Arlington, Texas. Now, when I do field trip, I typically, the first stop I go is City Hall. That's a place I can find the information about public meetings, the information about transit system. So I went to the City Hall of Arlington, Texas. And when I came into the City Hall, I did not feel welcomed because there was a human-shaped sculpture in the middle, in the lobby area. And when I came in from the front door, the human-shaped sculpture wasn't facing me. And I was intrigued by that. Why would you put a human-shaped sculpture, as if it turned back on people when people enter in the front door? So I noticed that they purposefully did that so that this sculpture would be facing the back door while people coming from the parking lot. Because most people will drive to the City Hall in Arlington, Texas, and then coming from the back door. So just think about that. As we making our, as the car is the default transportation mode in our cities, what type of experience we are creating for people who don't have access to car or could not drive a car, okay? And do they feel socially included or socially excluded, right? I mean, this is just a small experience, but think about all those embedded structural social inclusion we have in our city. We have to think consciously about what type of environment we are creating and how inclusive the environment we are creating. What about the future, right? So this is the Tech Brothers' ultimate transportation solution. And I cannot help but wonder that how are we maximizing human experience? What type of human experience, or whose human experience we are maximizing, right? Is it for all? This type of transportation system that we will build in the future. But I think a troubling tradition we have when we design transportation system is that we maximize efficiency. And we maximize the efficiency of a certain type of transportation mode. Okay? And I think it's very important that we think more equitably, think about how we have shared and positive experience across population groups. So why should urban planners be in the business of creating shared experience? I think, by now I think you know that positive emotions can be shaped by our environment. environment can be shaped also by human behavior. And our human behavior shaped by the environment, our environment. In fact, I think an experiment I often do, and I would like to do it here when I talk about happiness, is that if you could turn to your nearest person, nearest neighbor, just simply smile or make a smiling face. So look at each other, smile. How do you feel? If there is a barometer for sheer happiness in this room, the level it has increased. So in fact, there is evidence showing that even if we just make a smiling face, like even just putting a pencil in your, between your teeth, you actually feel a sense of happiness somehow. So think about that how urban planners or urban designers, we have a lot of power to shape people's emotional experience. Now you may say that those happiness is very fleeting, like it's not like it's very short term. But there is actually a lot of research in psychology recently focusing positive emotion and how describing, and prove that those short-term positive emotions can contribute to long-term human development. So this is actually a very recent model. I mean, I say recently, it's actually developed in early 2000s, okay? But traditionally, psychology tended to focus on negative emotions because, the negative emotions contributed to, mental illness. So they tended to focus on studying negative emotions. But Barbara Fredrickson, which is a well-known psychologist, and she also happened to study psychology at UNC Chapel Hill, where I got my PhD in planning from. But she proposed this theory called the broaden and build theory of positive emotions, and established the causal link between short-term positive emotions and the long-term human development. So when you're happy, what would you do? Or maybe I should ask, when you're not happy, what are the things that you're most likely to do? Stay at home, not talking to other people? So when you're happy, you're more likely your action and your thoughts are going to be very different, from when you're not happy. So this broaden and build aspects of aspects essentially will lead to more enduring personal resources, enhance the health, survival, and fulfillment. And more importantly, that establish a positive feedback loop. So therefore, by this theory, Barbara Fredrickson, and she also did a lot of empirical work to prove that this theory is definitely true. That positive emotions is very important to our society. It's very important to our long-term human development outcomes. So urban planners can really contribute to the success of our society by leveraging environment, behavior, emotion, connections. So I've done some work looking at the transportation happiness in general, and unfortunately, currently in the Twin Cities region, taking a bus is not necessarily a pleasant experience. Biking is the happiest. So it's very important that, given that public transportation is a sustainable mode, if we want to have a co-benefits, promoting sustainability and health at the same time, it is very important that we're making our public transportation experience more pleasant. So there's a lot to do, to make the bus experience more pleasant. And again, when we did the survey in the Twin Cities, we did not survey people who ride public bus rapid transit, but just the regular bus. Certainly, I think the experience of riding arterial BRT would be very different from riding a regular bus. We also look at what are the factors more important in predicting happiness in transportation. Mode is the most important. The second one is companionship, who do you travel with? And the third one is actually activity during the trip. And I think the public transportation, when designed well, there's a lot of activities people could do when they are taking a bus or taking a rail. Some of my work also illustrate how people with different gender, race, background have different experience in transportation. So here it shows that, female, when feeling unsafe, their waiting time experience is much less pleasant compared to male. We also did some work, and this is actually recently featured. We did it actually 2 years ago, but recently featured in Star Tribune article. Our transportation happiness map. If you're interested, you can look it up, Google it. And I want to. This is I think one of my last slides here is that I want to leave you more thoughts for the day. When we talk about shared happiness, it's really about we, the public. So promoting public transportation, promoting transit-oriented development in our cities, can certainly lead more shared happiness. And with that, on my last slide, this is a 4-minute short film actually created by an independent filmmaker in Minneapolis. The filmmaker, their studio is called Mind Twist. So they created this short film and which features the transportation happiness work we did. If you're interested, feel free to Google it and watch it. Thank you so much.
Thank you. So our final speaker is Elissa Schufman. She advocates for walking, biking, and transit is essential to making our communities more just, joyful, and sustainable. As Director of Strategic Partnerships at Move Minnesota, she enjoys building authentic connections, creating community among advocates, and organizing donors to create even bigger opportunities for change. Elissa brings her commitment to transportation justice to her volunteer services as the chair of the Minneapolis Bicycle Advisory Committee and on the board of Our Streets Minneapolis. Elissa is a multimodal commuter who enjoys exploring Minneapolis and St. Paul on bike, bus, train, and foot. She loves to explore her imagination through reading. When not bicycling or reading, she ferments whatever foods are in season. Welcome.
Thank you. Give me a signal if the mic is wandering too far from my mouth. I have so much on my mind after listening to everyone already talk, but I'm going to try to bring us to a close by talking about some things that show up across our work, regardless of whether it's research, it's public engagement, or development, no matter what our role is, or our tactics, or what the policy plans say, or who our stakeholders are. These 3 things are mindset, culture, and narrative. You might be thinking, what does mindset have to do with public health? What does narrative have to do with transit-oriented development? Let's talk about it. But before we do, let's just take note of the term transit-oriented development. We spent some time on that already. We'll come back to it. First, let's define what these things are for the purposes of today's discussion. These are words that have different definitions in different contexts, but for the purposes of today, we'll talk about mindset as the established set of attitudes held by someone. It's a way of thinking. It's at an individual level. Culture as the fundamental or underlying beliefs and attitudes that influence the practices of society, right? So that's a collective level. And then narrative, the stories we tell ourselves about how the world works. This is both internally in our minds and also in public discourse. Those are our 3 definitions. So let's see what that looks like when we apply it to our transportation system. When our individual mindset is that driving is easy and easy is good, collectively, we end up with a culture where cars are the normal way of getting around. And the way that we make sense of that is by telling ourselves a story about the fact that everyone drives and wants to drive, so that's where we should put the bulk of our attention and our resources. You can see very quickly the ways in which this impacts our decision-making process. Our mindset, our culture, our narrative influences where we end up. Let's look at what happens when we change our mindset. This is an example of a countercultural mindset, so not the prevailing norm in our society right now. But if we think about our mindset as driving seems easy because we made other ways of getting around hard, we see very quickly that that influences what our cultural norm is, right? We think about cars then as functionally, when people don't have access to other options because of the way that we've underinvested in our other systems, the narratives that we then tell make a different kind of sense about how we should act, focusing our time, money, and efforts on rebalancing that system. Both of these examples show a mindset impacting our collective culture, and as we try to make sense of that, the resulting narrative is hugely impactful to how we make decisions. And more often than not, coming back to that title, The Invisible Partners, it's invisible as part of our decision-making process. So how does that relate to transportation, to TOD, to public health? It matters because it manifests in and as our built environment. Our built environment has a huge impact on our culture. People largely do not bike where there are not bike lanes. They do not take transit where there is no bus service. With some unfortunate exceptions, if you follow the Twitter account St. Paul Buildings in the way back when that was still active, you know what I mean? They do not drive where there are not car lanes. Our built environment shapes our culture. It also limits our imagination. If you grow up in a community without sidewalks, why would you think that dedicated walking space is of value to you or to your community? So I'll say again, our built environment has a huge impact on our culture. But the inverse is also true. Our culture has a huge impact on our built environment. We can see that in our cultural narratives. The stories we tell about ourselves, who we are, the way that we make sense of things. Cars have become part of our stories and synonymous with independence, with bravery, innovation, sex appeal, family values, masculinity. The list goes on and on and on. But again, it's culture manifesting our built environment and built environment manifesting our culture. That means we can start to change our culture not only by changing what we build, which folks have very eloquently talked about today, but by shifting our mindsets and contributing to different narratives. As a language major who spends a lot of time in rooms full of engineers and planners, I want to spend some further time digging in with you all on this piece that doesn't come up a lot in these spaces, narrative. First, I want to talk about markedness, an element of narrative. What is markedness? It's a term from linguistics and social sciences. It's a comparative tool, and it tells us that which is marked is abnormal. That which is unmarked is normal. When we think about our narratives, markedness is a huge deal. It signals what is acceptable and also what is outside the norm. So you know what we don't have? Car-oriented development. You know what literally everything that isn't transit-oriented development is car-oriented development, right? But we just talk about it generally as development. We don't mark it. Because it's been normalized, most people can't see it. And we are awash in this car-oriented development, as others have already said. Development is not the only term in TOD or in public health that is unmarked, as you can see from my just short list of examples. Markedness also has implications for the term public health. We talk a lot about public health, but there tends to be a language void around its opposite, right? And it's not as though we have public health here and then we sort of have nothing on the other side. So naming the opposite of public health, marking that, is important. And that's public harm. And when you look at the impacts of our existing transportation system, our car-oriented development, it's abundantly clear that what we have is public harm. We see that harm enumerated in many ways. In traffic injuries and fatalities, in lack of access to medical care, in lack of access to food, in lack of access to jobs and the healthcare that comes with them, in poor air quality and the host of related things that come with that, in the huge direct and indirect expenses that we pay as an originating source and perpetuating source of racial injustice. Public harm is everywhere. I want to connect these concepts of public harm and narrative with a concrete example. This is something that I think of as the suburban affordability trap, right? So we come into this with a mindset, a culture, and a narrative that inform our choices. According to a study from the Center for Cities, the most common reason for selection of housing is how much it costs. And we know that suburban housing is less expensive for a variety of reasons. So people move to the suburbs because it's cheaper there. That's the narrative. But as anyone who has been to or lived in a suburb is aware, it's functionally impossible and culturally abnormal to get around without a car. So most people buy a car, or a second car, or a third car, depending on how big your family is. And at that average cost of 10 or 11K, that's a huge expense. So even though the housing is more affordable, you're not coming out that far ahead. On average, transportation is the second highest household expense, higher than the combined cost of education and healthcare. And we hear about those as big stressors for families all the time. We've all heard about the high cost of healthcare and the high cost of education impacting families. And transportation, on average, is a higher cost than both of those combined. What we also see is that there are additional public health impacts, right? So when we think about it from that great social determinants of health framework that others have brought up, people's least favorite characteristics of their neighborhoods is distance from family and friends. So when we talk about holistic public health, that joy and happiness framework, these social determinants of health, that distance matters. Your ability to ask a friend to babysit your kid on short notice, or salvage your dinner plans by running to the corner store for that missing recipe ingredient you thought you had in the cupboard, that matters. And of course, to enable all of this to function, because jobs are still largely located in cities, we have highways. Those highways belch out pollution into BIPOC communities, have those seriously deadly health impacts. We've externalized the cost of suburban development patterns. And again, here we see markedness is important. White communities are disproportionately reaping those benefits. We don't talk about that, while BIPOC communities are disproportionately faced with the harms. We love to talk about the burdens, but we don't like to talk about the benefiting. And what I think here is the trap, right? When I think about it as the trap, is you can't make a different choice once you're in this cycle, right? You have a car, you have 2 cars, you have 3 cars, you have no place to store those in the city. If you're a person who suddenly can't drive, or you're aging and your vision goes and you can't drive, it's very, very difficult to make other choices. And I think at each stage, we can see how an individual mindset or a narrative change might have influenced a decision-making process. What if we didn't talk about the suburbs as more affordable, but as costly in different ways? What if we talked about cars as incredibly expensive, instead of amplifying loan contingent rhetoric that cars are cheap? What if we centered the emotional payout of being near friends and family in our conversations just as much as we do the financial cost? We need to break the cycle of public harm, but it's hard to do that unless it's part of our mindset, part of our culture, part of our narrative. And that's where we all have a role to play. Shifting our mindsets and externalizing those mindsets to influence our narratives is an action we can all take, or not. We can mark car-oriented development. We can state public health as an explicit value. We can talk about who is disproportionately benefiting, not just who is disproportionately burdened. We can advance TOD, not as an alternative, but the obvious and normal thing to do for public health when faced with the continued harms of car-oriented development. Many of the people in this room do not think of themselves as advocates, certainly some of us do. And I think we are often in search of a neutral perspective, an objective perspective, something measurable that will allow us to facilitate an outcome without forwarding an advocacy agenda. And I want to posit that narrative, that mindset, that culture really make that impossible. Each of us is carrying with us a narrative, carrying a mindset, contributing to a cultural norm. That means if you are not advocating for change, the status quo has claimed you as an advocate. If you are not advocating for public health in your work has been claimed by public harm. There's no such thing as neutral in any of our work. I want to close today's presentations by challenging all of us to begin or continue to examine our perspectives and our narrative in service of being part of creating a culture, a mindset of public health and development, and in building communities and public spaces. How are we thinking about what is normal, and what if we were curious about that being different? How might our narrative change if we made more room for possibility? What can we say that changes the narrative and really shifts our culture? I want to name that this is lifelong work. I think about it all the time, and the only thing I know for certain is that each and every one of us has steps that we can take to interrogate our mindsets and our narratives, and I can't wait to keep working with you all to keep learning, excavating, being more imaginative in our narratives of what is possible, and keep choosing every day to advocate for transit, for public health, and for communities that encourage people of all ages, genders, races, and abilities to thrive. Thank you.
Thank you so much, and thank you to all of our presenters for pulling this together. This was great material. So we're going to start with a question and answer portion. I'm going to go ahead and invite the speakers to take seats up on the stage. If you have a question, just raise your hand. We'll bring a microphone over to you. Looks like we already have one.
Great, thank you so much to all the speakers. This is for the first two speakers from Hennepin County and from MNDOT. You know, I think you talked a lot about, to summarize in a real short way, you know, different ways that our transportation system are slowly killing people, to put it at a, you know, the ultimate public health outcome that I think we're trying to avoid. But I didn't hear you mention the word speed once in your discussion. And I think our county roads and our state roads are some of the biggest culprits, and frankly, in killing people from high speeds. And so I'm really interested in hearing your thoughts on how, on that intersection. You know, I appreciate the Lake City example, and I looked it up real briefly, didn't see anything about reducing speed limits on that project. You know, Hennepin County, numerous examples, Lake Street, Lindale, of where vehicles crash into buildings. So I want to hear about your public health thoughts on that perspective. Thanks.
Sure, I'll pass it on to Nissa here in a second. Speed is a great thing. So what I'm saying is, if you have a mission and a vision where this matters to you, then you're going to have different metrics and you're going to do things differently. So if you're not looking out for people and you're looking out for a road and you think the road should be maximized and anything to do with the road is great and anything on the other side of the road isn't your business, then you're not going to look at speed in a humanistic way. You don't care if people can get across the street, or if you do, that's great, you'll make some accommodations. But I don't think that's good enough. I don't think our speeds are set right. Myself, that's personal. We are working on this. I don't influence this at Hennepin County, but we're part of the dialogue where we're bringing that in. So this year, Hennepin County is redoing its Complete Streets Ordinance, and so they had a couple focus groups. One was on age-friendly and one was on public health. So they brought people together to talk about that, to inform how this moves forward. So that work is changing. Our work in active living work, when we do community or we do forums like this, one of our more recent ones was on different communities who have lowered their speed limits after the recent Minnesota legislature action where you can do that, and then how cities made that choice and how they rolled it out. So yeah, speed is a thing.
Yeah, I'll just add on, I really appreciate you bringing that up. And part of it is, if I just talked about Complete Streets, I do have slides on that, but I have 12 minutes. So you know, so our new Complete Streets website, we didn't have this before, but on there is the graphic, and I can't remember the exact percentage, but we show that often of the outcomes if you're somebody who's walking or biking, and your ability to walk away from being struck by a car is significantly different than if that car is traveling 20 miles an hour or if it's traveling 40 miles an hour. That is life or death. And so when we talk about Complete Streets, and we have a program within our office that supports district staff doing active transportation scoping, it's called, during pre-design phase. Speed is a big part of that, in introducing things like roundabouts. You know, how do you create the environment and talk about target speed where drivers feel like they have to slow down. So we have to introduce more of those elements in our street design, and that's where we're headed. You know, we have to get past this like wide open 12-foot lane mentality where cars have rein. So that is part of where we're headed, and we can't go there fast enough. I'll admit that. So thank you for bringing up speed.
I didn't hear any real discussion at all about the Americans with Disabilities Act, otherwise known as ADA. For example, you know, ADA has been around, I think, for at least 30 years. The Minnesota Department of Transportation has over 100 freeway bridges, pedestrian bridges, that are not ADA compliant, including 3 in my city of Edina. And you know, the population's obviously getting older, and it appears the only way ADA is actively taken seriously is if there's a major lawsuit. The city of New York City last year was hit pretty hard with more than a multi-million-dollar lawsuit, and now they are taking it very seriously. I was on Manhattan last spring, and the biggest thing I noticed in Minneapolis does a fairly good job of it, but the suburbs here do not, on construction projects. They feel construction takes priority over access, and that is part of ADA. And you take a look at a lot of construction projects, primarily in the suburbs, they don't care if they block sidewalks, they don't care if they block roads. The construction is more important than accessibility. You go to New York City, Manhattan, can't find a construction project that doesn't have a workaround to get around a building by non-motorized people or bicycles. And I just don't see that in the Twin Cities. And the biggest thing is these pedestrian bridges, MNDOT does not make them a priority. They are, you know, as much as I understand what you're saying, but you're a very small sliver of the road infrastructure in Minnesota, what they're doing. And a huge part of the budget is creating new roads or widening new roads, and not a lot into pedestrian infrastructure. And if you want accessibility, you need to get over bridges. And to me, that is the biggest thing. I just don't see it going on anywhere. There's new bridges being, I don't understand, there's new pedestrian bridges being built while there's over 100 that are non-compliant. Where is the priority there? The other thing is workarounds. And you know, we're all upset with the Southwest Light Rail system taking so long. That has destroyed a huge section of the Midtown Greenway bike trail. There's no accessibility through parts of Minneapolis and Hopkins. It used to have one of the best trail systems in the country. Now it is one of the most dangerous. I bike that all the time. I'm going down the wrong way on streets. I'm cutting across streets that have no pedestrian accessibility. I go around roadblocks on the trail that for some reason aren't open. There's a multi-million-dollar pedestrian bridge over the Greenway in St. Louis Park that's been built for 3 years and won't be open for another 5. I have no idea why it's not open. And so there's a lot of these issues that work around. I think when there's a major construction project, there has to be a safe workaround for non-motorized people. And I don't see that with the Southwest Light Rail at all. Thank you.
I'll just strongly agree with you. I mean, I think it's been a couple years since I did the actual look at the city budget analysis, but in the city of Minneapolis, we have like a 6-year budget process, right, where we say here's what we're going to spend our money on for the next 6 years. And at the rate we are currently spending on curb upgrades to be ADA compliant, it's going to take us like 120 years to have every curb in the city of Minneapolis be accessible and ADA compliant. Which, that's not a priority. That means we're doing it, I guess, between when we're doing all these other big car-focused projects. So yes, that's absolutely a problem. Even in places where it's better, we still have a long, long way to go to actually prioritize that. And I think, there are certainly there's stuff, again, that's the reflection of existing culture, right? In the city of Minneapolis, again, last I checked, it's been a while since I checked in on this, the fees for blocking a car lane during construction were higher than if you're going to block a sidewalk or a bike lane. Which means you are incentivized, if you're doing construction, to make sure that there's a road for, a pathway for cars, but not for people walking and biking, right? So that's a policy level change that's a reflection of a culture that isn't valuing the things that you're bringing up. And I just want to affirm that, yes, that's very, very frustrating. Other folks here working for different jurisdictions might have more to say about that, but.
Yeah, I would agree too. That's frustrating. We were just talking about this before the presentations about how often you see during construction, here's the detour for vehicles, but the sideway is just blocked for people who are walking. So that is something that needs to be improved. In terms of ADA, we do have an ADA office that has a plan, and we're reporting on that. And you're right, it's slow. And it's tied to when we are in areas touching those projects as a reconstruction or as a pavement. But it is required. I think it doesn't make it better that we're doing much better than some of the other states, but it's still not good enough. So we need more funding. I agree with you. We need more funding for walking and biking. We need more funding for ADA, and a lot of it comes from how are we talking about things And how does that reflect what we value? It's a really big puzzle, but we need to bring it back down to who are we serving, and we're multimodal, so I completely agree with you. We need to move faster, and we need to do better in terms of how we're making our transportation system accessible for everybody.
If I can say, Highway 100 was rebuilt about 10 years ago. The 2 pedestrian bridges over that freeway were not touched at all. So Minneapolis is redoing as they redo streets. They're currently on 50th Street. There's a major project for curb cuts. Highway 100 was never touched. And there's a bridge down on Crosstown that was hit. And MNDOT is not going to fix it. It's completely closed.
I also strongly agree with your comment. I think there's a lot of urgency to make our transportation system more accessible, especially for people with disability. And I think one thing I wanted to mention here is that we not only need those infrastructure improvements, we also need the public education campaigns, because the research has shown that only 20% of people are highly empathetic. So basically, that people who don't have a disability, they don't understand that the kind of experience that people with disability has. So there's some research actually, kind of very pioneering work done by, I forgot the university name, but they're using virtual reality, to study, to help people who don't have a disability to understand the type of experience that the people with disability has. So I think we need more work really centering, put people with disabilities experience at the center stage when designing our transportation infrastructure.
I want to build on this. First of all, I want to say thank you to all 4 of you for your amazing work. I can't see all 4 of you at once, but you're all very inspiring, so thank you. My name is Allison Bell. I'm with Bellwether Consulting, and the comment about kind of change, and I think we're all very frustrated by the rate of change and how slow this is. And at the same time, we have a historic influx of federal funding and a huge state budget surplus. There's a lot of money, and there's, I think, a lot of concern, at least on my part and others, that a lot of decisions still remain to be made with EJA and all that federal funding, and where are those decisions being made? How are they being made? Who is making them? And how are we going to ensure that that money doesn't just kind of follow familiar routes and continue these systems? And so I guess my question, and that's a huge question, right? Like EJA is gigantic, and then we have the Inflation Reduction Act. So I guess my question for the government folks is, what do you see happening? What opportunities do you see on the federal side? And then also from the advocacy side, what do you see as the opportunities for folks to engage in those conversations and be able to have a voice in how that money is being spent?
Yeah, that's a really great question. So you're right, we're at this momentous time. There's an influx of funding, and there's a huge responsibility for how are those decisions being made, how are we funneling that money, who is it benefiting? I am very inspired by the Justice 40 and at the state level approach that we are one agency, right? Like, I think traditionally there are so many silos, and we need to be thinking about the Justice 40 and the funds in terms of how are we all as state agencies working together to make sure that we're doing our best to utilize the full resources of those funds and those full impacts. Part of what yet still has to be defined at the federal level is what does it mean to provide that 40% benefit? How do we define that? So that's something that, for example, we're working through with the National Electric Vehicle Infrastructure Plan that we just submitted. 40% of the benefit of those dollars needs to go to EJ communities. And that hasn't been defined by the federal government, and we have to define that quickly. What does that mean? We know that car ownership is expensive. So how does that infrastructure benefit EJ communities? There's a really great organization, EV Noir, that focuses on equity and electric vehicles. And there's some opportunities there around like readiness and how ready are BIPOC communities able to access and use this infrastructure and feel comfortable. So there's one thing, but we need to define what does that mean. And there's like I don't have like a here's the 5-step plan of how it's going to be used, but I think that this question needs to be continued to be brought up at all discussions. How are we using it? How are we specifically benefiting EJ populations? We have this great opportunity and we can't waste it. So.
Yeah, I mean, I think from an advocacy perspective, right, you know, as someone who doesn't work in government, one of the things that we, I think, hold as a North Star is like, we have lots of policy and we have lots of plans, and the thing in front of us now is to do the thing that we know we need to do, right? So we could continue to spend a lot of time coming up with definitions, which are important, and thinking about how particular policy frameworks tier down, but one of the things, like it's been year after year after year with, we're at COP27, but COP26 and COP25, right, say over and over again, like investing in transit is our climate solution, right? It is like, it is a, I think they describe it as like a no-fault climate solution. There's no drawbacks, just do lots of transit, right? And so I think there's both a need to do some of the work that you're talking about in terms of those definitions, but also to just sort of do as much as we can as fast as we can, right? Like doubling the amount of like lines that we had in our transit system in the Twin Cities would be phenomenal. We don't need like a study to tell us that. So I think, you know, from an advocacy perspective, thinking about how are we pushing, you know, this upcoming legislative session, are all very newly elected or re-elected decision makers to do as much as they can with the frameworks that they already have. MVEST, the motor vehicle sales tax, right, already has had flexibility built into it for years, where it has a maximum you can spend on cars and a minimum you can spend on transit. And we spend the maximum we can spend on cars, and we spend the minimum we can spend on transit, right? And so it's really about what are we doing with the frameworks that we have to push people to think differently and make very, very quick change. Certainly, I don't know what the conversations are like internally about how that money is flowing, but you can bet that we're going to be talking about it in the next 4 to 6 weeks.
Yes, I mean, I agree with everybody here. One of the things that some of my colleagues and I that talk about, you know, offline is the idea that, you know, is a person in a car more valuable than a person walking in the same community, or a person on a bike? Isn't it just a person that we're providing transportation to? How much resources are we giving, how much access are we giving to a person who is traveling? And so to that end, I mean, I see from my work, which is working on that, off of that minimum investment, you know, funding and trying to figure out how we can leverage our small amount of funds to have people look at things differently. Well, what if every transportation project had a percentage devoted to to other types of transportation? So if you looked, every road investment had to consider walking and biking, and it was part of the budget every single time, and part of every single consideration. We would do things much differently than fighting over like $1 million in pedestrian infrastructure that we like, how should we spend this? $2 million we have for the whole state. Oh, well, that's nothing. So how can we budget differently? How can we do different metrics? Because if you have a metric about making sure that the communities your transportation or your infrastructure piece is going through are still connected once you've gone through, you would do things differently, you'd spend differently, you would measure differently. So budget, metrics, all those things are really important, and I would love to see those change or evolve fast.
Hi, I have a question. I think it might be more for Nissa and Denise, but I'm curious about when street projects happen, how do you coordinate with transit-oriented development that might be coming along after the project, like soon after the project is finished? I'm thinking specifically, and I don't know all the details and dates, about the Amber apartments that are on Hiawatha. Hiawatha was recently repaved, and it's right by the 46th Avenue transit station with the light rail and a bunch of transit connections there. I see people crossing in the middle of the block all the time because they don't want to go down to the light at 46 and 46 and Hiawatha because it takes forever because it's car prioritized for the signals. You have to wait forever to get a crossing, and it's kind of scary to cross there because there's a pork chop island you have to cross, all those things. There is an intersection, there's a street right there where those new apartments are that are affordable apartments, but there's no crossing there for people, to just get to the transit station directly. So I'm curious how you think about or coordinate with buildings that are coming in that might be either soon or in the middle of that road project. I know I attended a couple of public meetings for Hiawatha and was told that things were out of scope. And how can people engage with projects when, there is a limited scope, obviously you can't do everything, but it felt like there should have been that embeddedness of those priorities in that project. So kind of two-part question, how do you coordinate and what can people do when they're told that something like that, like pedestrian crossings, is out of scope for a project? Thank you.
Yeah, thank you. The first piece, it's complicated. Sorry, I want to see you to answer your question. One thing, speaking of narrative and how we talk about things, is you'll often see the way that it's commonly talked about for land that is in the right-of-way is MNDOT-owned land. And I think we need to shift that a little bit and think about how we are in custodial control of that land. That land is state-owned land and it's for public purposes. So, that is a push for the transportation agency that used to be a Department of Highways. We do have, when we think about right-of-way, there's lots of encouraging work happening to push the envelope in that direction of what is this land being used for? Is it being used for the greatest public service? And what is the transportation purpose? And so there's a lot to unpack there. There's lots of legal processes, but I think it starts with partnership, asking the questions, having conversations about what we can do, and asking again. That's how we see change. But I think there is opportunity there when we think about the creative uses of right-of-way work that's happening, and we just have to remember that that land is all for public purpose. So if there's public agencies that want to partner, then we need to go there. Another thing is, we've been internally making the shift of, there's a transportation purpose and there's, a comfortability with leading, and that's where we're comfortable. But we need to shift to where can we partner and support, where we might have some funding or some land or some resources where we can be a partner, come to the table in a supportive way to achieve the outcomes that we all want to see. The Complete Streets policy, we need to be taking that Complete Streets approach to all of our projects. So, on the street side, that means that infrastructure to allow for that safe crossing. But also when you think about TOD, what's in that right of way? And how can that be used for public purpose? So I appreciate you bringing that up. I think it really starts with that narrative shift and what are we defining and how, and keeping to ask that question. And your second question, how, I think I answered that too, but I think, did anybody else want to add on to that? Okay, thank you.
We're right about at time, so I think this will be our last question.
Thank you.
And I don't know if this is a question more as a comment and just some thoughts that are coming through, but we're holding this forum in a context where we have some pretty big transit service cuts that are coming down the line that will really impact people and their ability to access transit, reliable transit. And then also, so I work for St. Paul Public Housing Agency. We have a high-rise that's near, it's right across the busy road from the Sears site, if anyone's familiar with the Sears site outside of downtown St. Paul. Really exciting project for redevelopment that's going to happen there. Yet this high-rise has been working for many years to improve the crossing to get across Marion Street, which is essentially a 6-lane highway leading up to on and off ramps to get to the interstate. And so, just this fall, the county installed permanent crosswalks. So people, and with a center median waiting area, so people could more safely get across that street. However, earlier this summer, that bus stop that's so meaningful to people the service to that stop ended. It was cut. You know, no heads up. Maybe on social media there was information about it, but nobody came to tell the 250 plus people who lived in that building. And so it's a little ironic that we finally made those changes, yet now there's no bus stop to get to. The next closest stop is over on Rice Street or the light rail station. And that's really challenging for a lot of folks who live in our building because, you know, there's a lot of folks who have mobility challenges, older folks who just can't get that far. And so, you know, now the Sears redevelopment project will be happening and I imagine we'll have better transit. But what if that project wasn't happening? What will we do to serve those communities? Who do we value in some of these decisions that are made? And I know a lot of it's around funding, but how do we invest in that? How do we have a transit system that really does serve people and not only people who are going to be living in these new fancy apartments that are being built in these exciting new like redevelopment projects? So I don't know if that's a question. It's more just some thoughts and just experiences of my experience working with communities who have been undervalued, underrepresented, underserved in a lot of these systems and policies that affect them in their daily lives. And also, they may not have as high numbers at some of these bus stops, because I know we look at data, but how important is that stop to somebody? So is it quantitative data? How do we add in that qualitative data when we're making some of these decisions?
I can let other folks speak to qualitative versus, is it still on? Versus quantitative. First, I will say, Move Minnesota is organizing around the transit cuts. If you would like to be involved in that, come see me after. Get on our email list. More information forthcoming. But I think okay, so that's one piece. I had like so many things floating through my head as you were talking, and I need like a second to gather them all up again. Take the mic and immediately forget what I was going to say. No, I need a minute. So either of you want to talk about qualitative or quantitative data? Or Yingling?
What I'm going to talk about, I'm probably not going to answer your question, but I just think, this region really need high quality public transportation, because if you look at, a lot of people don't pay attention about kind of the population trend in the region, but the data has shown that not only our central cities got denser in the past 10 years, but also our suburban areas also got denser. So if you think about the travel demand of those, of those people, that given the population increase we have seen in the region, that it's very important that we develop kind of a multimodal transportation system, because we don't have more spaces for more highway constructions. So I just want to emphasize, and I really like what Elissa mentioned earlier, is that public transportation is a no-fault solution, and if we don't invest in public transportation now, we may end up in a very bad situation that we will have congested systems and people don't have mobility and accessibility that are really needed to live a full life.
I got there eventually. So I think first I want to say, like, the driver shortage with Metro Transit is very, very real, right? Like, there are many places, like hiring and keeping folks employed right now is a challenge for lots of different sectors. So I don't want to undersell that as a part of the transit cuts, and like, that's real. If you don't have people to drive buses, they can't go out the door. And I think when you think about the amount of funding that we put into our car infrastructure versus our transit infrastructure, and our sort of operations of our car-oriented development and our car infrastructure versus transit is massively underfunded, right? And so there's changes that we need to make as a state, at the state level, to make sure that Metro Transit has the resources to operate the transit system well. Even within that, even within our existing resources, there are also big opportunities. For example, if you're a new person trying to get hired at Metro Transit, you don't get assigned to a depot. You get assigned, like, I have a couple of friends who are like, oh, I could be a bus driver maybe. This is like a cool form of public service. And as they went through the interview process, it became clear that they, as people who did not own cars, could not take this job, because they would be assigned to a bus depot on short notice, where the transit system couldn't get them from where they lived to the depot where they worked fast enough, right? So it's like, if you need to get from where you live to a depot and it takes you an hour and a half on transit and you have 60 minutes notice that you're gonna be assigned to that depot, you can't take that job, right? So even our transit system and the way that that's operated in terms of hiring is like, it requires that you own a car. Similarly, when we think about where are we putting our resources and what makes people feel safe on transit, one of the things that makes people feel safe on transit is when we have lots of people riding it, right? We know people ride the service when it is frequent, when it is reliable, and so these like service cuts make people feel less safe. But the thing that we're not doing is paying bus drivers as much as we're paying Metro Transit police. The hourly starting wage for a bus driver is significantly less than the equivalent hourly salary for a police person, right? And so when we think about bus drivers as part of the safety of our system, we think about paying them differently, right? And so I think there's just like so many moving parts to how we think about equipping our transit system better and solving the bus driver shortage that really is at the heart of these service cuts. And I think there's like a lot of different choices that we can be making to really bolster the system differently, but lots of different people are in charge of all of those, so it takes some advocates.
One quick thing just to leave people with, on your comment about you finally got a crosswalk in a safe landing spot in the middle of the street. I think one of the best things we can do, and this is more a personal thought that I'm hoping to bring into my work, is that we underlook at walking. Walking, rolling is the most equitable form of transportation. Not everybody can do it, but most trips start or stop with a walking equivalent. And we don't, if we're gonna grow happiness, if we're gonna grow equity, we have to focus on that environment first and foremost. So if you're gonna get to transit, there's gonna be, if we focus on a walking component and grow empathy for people walking outside of a car, I think we go a long way, because then the biking environment also comes along with that, and we should bring that along together. But getting people to be comfortable and feel safe in their neighborhoods, going to a local place, is just the key. It's just so key to getting people to get on transit, to get to local destinations on foot, to feel safe and do it. And then we grow empathy for the different modes. So, I mean, I just think that's a big deal.
All right. Well, thank you all for coming. I think that was the last question we have. Yeah, if you wouldn't mind giving our panelists one more round of applause. And that's all we have. Thanks for coming.